oh my God, if they're doing this at the Four Seasons and at Love and Madison Park, why aren't we doing this in healthcare? They are paying so much attention to the customer experience.
How can I learn? How can I grow? How can I do this better? That mentality is so critically important.
Take care of your teams. If you take care of your teams, you're going to get them to want to give your patients or customers that amazing experience. Be patient obsessed, and everything else will fall in place.
On today's episode of the podcast, we'll be talking to Dr. Shoma Datta Thomas of Next Health. She's medical director there, and she's leading an important charge in making sure that in-person care is really at the center, at the core of what they're doing at Next Health. We'll be talking to her about using digital tools as an extension of human interaction, of how AI can actually be used to help increase that personal touch with their patients. And we'll be talking about how no matter what happens with technology, you'll always need human beings to help draw you all the way to the finish line and making sure the patient gets the kind of experience they expect and demand. We're excited to be talking about healthcare today. Let's get started. Shoma, thank you so much for being on the podcast today. We're really excited to have you on the show.
So glad to be here. Thanks for having me.
It's neat to be able to talk about the healthcare space. It's a space that's really grown a lot when it comes to the digital experience. And in particular, to talk about it from your perspective as a medical director, because you not only see how digital is impacting the world of care, but you are obviously intrinsically interested in the world of care as a doctor, right? You're not just simply some administrator, but you're someone who's interested in the actual care of the actual patients that you're serving. So your perspective is really something we're excited to have on the show. And in particular, there was a comment that you made that I really want to make sure I get right. You mentioned that digital tools should be an extension, not a replacement of real care. Can you talk a little bit about why that distinction is so important to you?
Yeah, absolutely. And to your point, I think my role being both a medical provider, I'm still seeing patients, and also a lot of insight and influence over our back-end operations just makes me realize how important those workflows are. So I get to be at that front line. And I think it might sound obvious. I think I'm stating the obvious, but still at the center of healthcare very much is the care part and that connection. And from 20 years in medicine now, taking several members of my family through pretty serious health conditions, over and over, that's what you go back to. What was your experience? Who's on shift that day? And those are not necessarily objective measures. They're very much, how are we connecting? How am I going to anticipate conversations going that day? How much time are they going to take with me and walk me through things? So I think at the end of the day, definitely let's, wherever we can, depend on our digital tools as an extension of us for, expanding our reach, expanding our access, expanding our efficiency with our time and our interactions. But at the end of the day, there's still a real priority for me to preserve that connection and interaction on more of the human basis, which I think sounds like, again, I'm stating the obvious, but over and over has shown up for me as the most important part.
It's funny you say that. It's not stating the obvious, right? It seems very obvious. You would think. I mean,
right.
To your point, like it's called healthcare, right? But very often, certainly in other industries, but even in the realm of healthcare, we kind of don't see it all the time, right? We see very much a disconnect, right? It becomes very kind of stale, right? It becomes almost very business-like in the relationship that's happening in the place where you really expect the highest degree of quote unquote customer support or customer service, right? This is dealing with my health. This is dealing with my actual life, right? So while, a person can see the advancement of technology and leveraging digital tools and so forth, ultimately, this is about me, right? This isn't about my car. This isn't about my TV. This isn't about my mobile phone. Like, this is about me and my life and how it's affecting me personally, how it's affecting my family members. So you can really see how the importance of keeping focused on this is about caring for people has to really maintain the kind of North Star, right, vision. And that's something I appreciated in talking to you earlier and even preparing for this interview, that's really is your North Star. So as you've worked at Next Health and as you've gone through this process and seen the leveraging of digital, how have you made sure to focus on in-person care, on in-person continuity, and making sure to recalibrate the model there at Next Health to make sure that it happens?
It's been an important focus, and I think over and over has proven itself to be the right place to go, both from the provider presence and the patient presence. So on the patient side, we do try to get that first interaction and first visit with us to be in person. Of course, there's schedules and whatever we can accommodate, but that's always our first attempt. Is really let's get that first person to person interaction and visit. It's why we double down on investing in brick and mortar locations. That's extremely difficult to do, but we really want a place for everybody to come together and start to kind of getting into our ecosystem and our community. So first of all, really trying to prioritize at least the first visit, and as many as possible for the patient as an in-person time. There's great ways to utilize digital and telemedicine presence for quick questions, follow-up visits, follow-up procedures, things like that to walk through and prepare for. So I think there's lots of uses, but we really do want to make the foundation we want to use the digital aspect as a follow-up or an addition to an already established connection that you've made in person. The biggest, I think, eye-opener for me was really prioritizing that for our providers, right? With COVID, with the pandemic, many industries, obviously, as we know, went to a remote working model. And when I joined a little over a year ago, we were still doing, 1 or 2 days for providers, remote, and then the rest of the days in person. And we just realized that wasn't it. We weren't delivering the quality of connection and care. And I really think at the end of the day, truly, job satisfaction for the providers with this kind of in and out model. Not for what we wanted to do at the end of the day. Our mission, vision, value were really about creating those, the excellence in care, and we weren't delivering it. And when I was watching some of the consults with the providers, on the Zoom recordings, or even how our meetings would go, or responses to questions and things like that, there was definitely a level of disconnect. Not in a bad way, or giving bad advice or anything like that, but just again that engagement, the connection, the discussions, like kind of the fullness of it wasn't there. So we made a very intentional decision that, hey, we are a fully in-person job. There are some that can be remote, but for us, we are always going to be in our location. We want to be where patients come to find us if they have questions, where our medical staff also comes, because very much our providers are the medical authority at our location. So we want to always be there and present as much as we can for our own teams and for the patients. And I will say, we probably did that late last fall. And for me, from what I see, it's really made a tremendous difference in the connections and engagement on the patient side and the provider side.
That's great. I'd love to kind of dig into that a little bit more. You mentioned first the providers, their satisfaction has improved. What kind of feedback have you gotten from kind of taking that direction, making that shift? What have they kind of said to you that you really kind of feel that improvement?
It's more what I see from the bird's eye view. So, we have 6 corporate locations, and, even though I'm in New York, I know the LA teams very well. And just all of a sudden, just getting more engagement, even in our weekly meetings, in what they're doing outside of work, reading more resources, watching more podcasts, getting more information on their own, and that self-education. And that takes motivation. You don't want to go home and necessarily dig more into what you're doing all day. And so to have that interest very much in the field that we're in, you have to do some self-education. You have to be pursuing that independent reading and research. And I feel that has really amped up a bit. Their success stories on connecting with patients has also been something brought with more enthusiasm and frequency and sharing it, and also their connection with each other as a provider network. Just even if it's something that's still, ironically, a digital way of connecting, in that we're in the group chats more, but if it's coming off of, all now being in this authority position together in their locations, even though it's one per location, but sharing that experience, what is it like? Just kind of asking them to do more, but I think very happily finding it's very satisfying leading a team, and you really can't do that unless you're in person.
I love to hear that they're so much more energized, right?
Yes.
They're just right. They're just really into this experience and what they're able to deliver, and that they really recognize that, hey, there are these great digital tools that help us to deliver a wonderful experience, but ultimately it's on us as people it's our responsibility to deliver that experience, and that's energizing them, right? Making that connection. So that's super exciting to hear. So let's look at it kind of from the other side. Again, from that bird's eye view, what have you seen from the patients? How have you seen them respond?
Well, I think they just give a little bit more feedback on, oh my gosh, I love seeing Alyssa. She always is this, and that. And even if it's not necessarily about the medical care, if it's the little side conversations they have, or, she got to follow up with me. She asked me about my trip to Italy, or, whatever it is, kind of these personal touches that really leave you feeling good. And very much the Maya Angelou concept of, people may not remember what you say, but they'll remember how you made them feel. I think over and over, that's more of the examples I've been hearing or seeing patient testimonials around is just, wow, she or he sat down and just talked through so many things with me and really understood me, gave me the time and space to be seen and understood. And that over anything else I've seen on our care model, where our consults are usually an hour, and follow-ups are at least 30 minutes, and we present a deck. We literally are presenting them with a deck of their data and our options, and just that level of attention of, here's what we tested on you, here's the way to walk through it in the context of your personal goals, experience with us, time with us, what you've done and what you're hoping to do, has been tremendously valuable. And that is always the question I get is, why can't my own doctor do this? Why can't my own? And the reality is, we talked about the centering, the connection and care, and why that's not happening. The reality is, I was a physician in the system. I guess I like to call it the traditional system for 15 years. You're just under a lot of pressures. You're trying to deliver all the good medical care. You're trying to practice good medicine and guidelines and patient safety and goals, and you're doing it on the clock, right? You're doing it on the clock, and that's just what our system is right now, and we have to work within that. What we've done, and being part of a cash pay model, is we've really prioritized the time we spend and the education we can provide and the discussion that we can provide during that time. It's just not possible. And my physician colleagues, it's not because they're not excellent providers or just as motivated to do that, but what they're allowed to do in that system is different. I like to say at Next Health, I see over and over, the patient is allowed to have the care delivery in the way they want it. But also on the other side, I think the provider is given an opportunity to deliver it in the way that they would ideally want it to. And since I've moved more into this model the past, 5 years or so in my career, the conversations I have, the connections I have, the real understanding of, oh, you know what, this is the focus now because she just became an empty nester, or she just came out of a relationship, or she's at this point in her career, and I didn't always have that understanding before. So I think from both aspects, it's how we would want it done.
The perspective is so well aligned with even other businesses outside of healthcare, right?
Mm-hmm.
On the show, we talk a lot about the post-click experience. So what happens after all kind of the advertising and the pretty marketing and so forth, when kind of the rubber hits the road and it's like, okay, now I need to make a decision. I need to decide what I'm going to do. And sometimes it's going on a website, and that's, making a booking for an expensive vacation, and you're taking all those things into consideration. But even, booking an expensive vacation, there's a lot of emotional risk in that. There's a lot of financial risk that's involved in that. So you kind of take that and you ramp it up times 10 when you're talking about, someone's health, right? Their actual well-being. And ultimately, again, similar to a vacation, it's not about the experience you're having online. That's a means to an end to get to the experience that you're having in destination with your family, with the staff, right? And how that ends up resonating and kind of delivering what you were looking for. So in the same sense here, I can very much see I'm fine going to a website and maybe looking for a time for an appointment and seeing if this is the right place for me to get the kind of care I'm looking for. But ultimately, what I'm paying for, what I'm looking for here, is a doctor who cares, who shows empathy, who shows concern, who's engaged with me. The digital is just a means to an end to get to that, to deliver that experience that I'm looking for, that makes me feel like, okay, my fears are coming down, my uncertainty's coming down, my doubts are coming down. I can feel like I can be open, I can be comfortable, and I can get the kind of help that I ultimately need. But just like anything else, ultimately it is a business, right? You've got these brick and mortar locations. You've got some, obviously some financial concerns, some operational concerns. How do you balance those kind of financial, operational concerns with making sure you maintain that experience, that empathy, that engagement that people ultimately are looking for?
Yeah, it's a great question. And I don't know that anybody's really figured it out perfectly. As you know, with Next Health, we are undergoing a pretty massive expansion over the next couple of years with franchising. So, what we're seeing over and over again is really the need for immediate systematizing of everything. And I think digital tools can really help us with that, just in workflows, in our training, in our education, and also in how we're kind of leveling up our own, electronic medical system. What are we doing in all of those areas? So it's a massive project, and I think very much we're still in the building phase and perfecting it as we're launching our first number of franchises. We're seeing just where the biggest needs are, but I think whenever you can be efficient, there is a financial incentive to do that, right? For me to keep sending my lead nurse to this place to do training over and over again, or to field so many questions after we've had a conversation on this, versus just a really clear training program with videos with the right information at the right time when that team is ready is I think really the key. And anytime you're saving your bandwidth on your staff, on your team members, on your trainers, that's automatically a financial gain.
I'm sure you have so many more tools at your disposal probably than when you started your career, right, in medicine. AI obviously is, being injected into every single industry. I'm sure it's being injected into medicine. I know there are diagnostic tools and tests that AI is kind of, looking at the data and evaluating and hopefully helping to surface some information that perhaps it would take a doctor longer, spend more time, right, to kind of dig into the information and the test results. Um, how have you seen kind of both the pros and the cons of these digital tools in terms of how they're helping you, but how they're also maybe falling short a bit as you kind of started to incorporate that into the medical operations?
Yeah, technology in medicine for me has been really interesting. I'm a robotic surgeon by training, so I'm always trying to look at the next, shiny bright toys or the next tech applications. And I'd once read interestingly that medicine is the only field that has lost ground or become less efficient with tech and digital innovation. I think what we're seeing is that there can be a solve. Um, uh, there can be some correction of that, I think, with AI is what I'm hoping. Of course, it's only as good as we build it to be, but some of the really big handcuffs around security and privacy, although very, very important, has been very, very clunky for us to use as medical providers. So I'm hoping, some of that is resolved with some newer tools. But at the end of the day, I think how I'm seeing it be a big area that I'm really excited about is, again, just if you think of it from the provider experience, the first way that we've incorporated it is through an AI scribe program. For me, I'm really personally invested in getting that provider experience to be the best it can. Because if you have a happy nurse practitioner, PA, nurse, physician, the happier your patient is going to be. If you, a patient will read you in a second. If you are overburdened and in a rush and just have 100 things on your mind, they're going to read that too. If I'm sitting there and I'm typing away, that's just a crappy experience, but it's necessary, because still what we do as physicians and medical providers is we try to engage during the visit, and then there's still hours, and I'm talking hours, I'm not exaggerating, of charting at home, time away from your family. You've spent all day at work. Now you're doing the time away from you can't do bedtime. You got to go chart, or you're charting until all hours of the night. It's just an insane existence. And so I'm really, really, I always say, help the tools help you. And if you're charting for hours, you're doing something wrong. We are now not having to meet these nitty gritty kind of odd demands of insurance to see in notes for reimbursement. Let's make it really about the content of the visit. And you can do that very efficiently. I've been very impressed and very welcoming for AI scribes and these programs that will just take a transcription and honestly create a note, and it gets it, I think, 90 to 95% there. I'll go in and put some edits there. What I've honestly found myself doing is, in a de-identified way, put in some information into ChatGPT, like, help me revise my note so I'm delivering it in a better language for it to be understandable. It's not in medical jargon. I'm still kind of doing some of it in piecemeal, but I think, it probably already exists, and there's a way to really just get that, in person or Zoom visit recorded, actually, build the algorithms that I know are already happening that help interpret those results. It can help lead the provider. I can put it 80% there. I prepare for my visit. I already see kind of the interpretation of their data in a way, in broad strokes, that's going to be appropriate. I can think through the nuances and, then when I deliver it, have the discussions, that's going to put it in context. That's going to align, on their goals and what the actual next step action items are. And then I can have a perfectly designed and integrated visit note. And then also something for us, we really try to send always back a plan to the patient as well. So creating those different levels of, just kind of get me 80% there, very much the human in the loop model for sure. Just get me 80, 90% there. I can just program, this result range means this and that, and then let me as the provider go in and put that last layer in, and then just the manual of the documentation and charting and communications with the patient then can be put into place too. And then guess what? When I'm done, I'm done. Right? I can go home, enjoy time off the clock, enjoy time with family, friends, and honestly, just let my mind free up a little bit, maybe about even, like what I saw that day, or, and actually, like, let me listen to that podcast on this or look that up a little bit. There's just no time when you're continuing your work at home. So there's some people that are still not used to that in medicine, and they're like, "Oh, this is never going to do as good a note as I can." So there is some, I think, ego and mistrust of the tech, and also, this fear of being replaced. And what I have to say to that is, listen, this is happening. It's going to happen with us or without us, and so I think let's be part of it. Let's be leading it as medical people and care, because one thing I see over and over when I'm working with dev teams, which is also a really cool part of working outside of the conventional system. I can work with our, software developers. I can work with our marketing. I can work with all these other teams. And, we can all connect on what's the back end and front end experience for the patient and provider. But it's very clear some have never talked to a provider or actually never understand or have visibility. And I just never realized that. I never thought about that fact that, this is maybe why it's so difficult, because you actually don't know my challenges when I'm talking to the patient, or you don't understand what's happening in our interaction and how can that be improved. So I'm really hoping that over time, that gap is closed. And when I talk to people in our teams that are developing these tools, to give them a more of a really keen understanding. And hey, when I'm talking about this, it always shows up in my notes like this, or this is how I want to send it to them minus all of the medical jargon. Those conversations are really meaningful, and just getting that tone right and getting the workflows right.
I love how passionate you are about this, because to me, what I'm hearing is, hey, I can use some of these tools to kind of get the monotonous kind of like paperwork stuff out of the way, so I can kind of relax when I get home. And when I come to work the next day, I can be focused on the patient. Like my head, I'm not like, I didn't get only a few hours of sleep. I'm not coming in tired. I'm not rushing through them because I've had a rough morning and I'm on my third cup of coffee, right? It's
Right.
just like I can be engaged and focused on the patient, because some of these tools help me get some of that some of that administrative work out of the way. And now I can say, hey, now this can be about you, right? And I don't have to fret about the fact that I'm going to have to spend 6 hours after I get off work, making all these notes, documenting everything, getting it all right, right, dotting on my I's and crossing my T's and so forth, and doing that. I am curious though, from the patient perspective, right? I think it's great to hear that from a patient perspective. I am curious though, because all these things are so, so talked about in our space, in our world. They're so talked about on social media, right? And on the news and so forth. Do patients come in and are they expecting some like high tech tools, some AI diagnostic tools, some, wham bam Star Trek stuff for you to be using as a doctor? Like, what is their expectation when it comes to these technologies?
I think at the end of the day, they want an easy interface, if we're using any tools. So with our website, we're kind of rebuilding our app to make it a better experience, just iterating based on the team's input and the patient input. And I think I would venture to say, and based on conversations, they really still want to have that human conversation. And then the in between, they want the very tech forward, easy tools, right? But that is still really valued, the interaction and the breakdown and the discussion. Because I think there's some really great companies out there that have done a wonderful job of getting access to testing. Frequently it's still, you're still purchasing it, so you still have to pay for it. I think they've done a great job of getting it out there. And the pendulum has swung from, when I was training, it was don't order any, it can't be a patient requested test, or it can't be something that insurance won't cover. And that's a whole, that's a whole issue in and of itself. But that really kept us from offering testing frequently and keep checking up and repeats because insurance wasn't going to cover it, or then they have to pay. And, I think the pendulum has swung now where people do want to invest in it. And some companies, like Function and so forth, have done a great job of putting that out there and the opportunity to, you want to have your eyes on this, you want to pay attention to this aspect. Here's this panel of tests. Now go get it drawn, and we'll have some great algorithms, based on some really expert input to give you the analysis of it, in a report. To be honest, I love that, but I still see a lot of patients come in, hey, I have this huge report from, and there's several companies that do this and several types of tests that do this. And I have this huge report. I don't know what this means. And I just want someone to tell me what to do. Right. So I think we're just still to the point where we haven't quite figured out the solve for context and for the patient's next immediate action items in their lived experience. And I really hope there's always a human doing that. At the end of the day, again, I would love to see AI and digital tools bring it to the 90% mark, and then, that next kind of human bring it to the finish line for that real custom finish. So I think that's a great example. Hey, I love the technology there. I love the access it's bringing. I love the feedback it's giving. But that little, small kind of touch in, okay, now, Shamir, what are you going to go out and do tomorrow about this report that you're getting? That's still the piece that relies on the expertise, the understanding of context, nuance, goals for that individual.
Because of the nature of your patients and because they're paying out of pocket,
Mm-hmm.
do you think that your digital experience at Next Health is even more important than it would be at the kind of the typical, system healthcare provider?
I do. And, I think sometimes I take a note from when you hear airlines. They say, we know you could have chosen another airline to fly with. And, you're investing your time and money. And those are the two most important things to anybody are their time and money. And you're choosing to spend them with me. So I have an obligation to, of course, number one, first and foremost, deliver good medicine and good care. But also, you're going above and beyond to get that good experience. So let's give you that good experience. And I think that's where digital tools, convenience, kind of a more of a seamless, we really stay connected to our patients on multiple levels, even if it's something as easy as, hey, this is email access to us. This is our executive care coordinator. This is our general manager. This is our provider. Another thing that we did when we recalibrated and made it an in-person provider presence was, hey, we're going to have everybody email us if they need to, our patients. And I think again, the workload, and that may seem really intimidating to a provider. I don't find patients abuse it. I think it's very meaningful for them just to know, hey, if I have a question, I can reach out, and it's an easy way to interact. And I don't find, for things that don't require medical privacy and things like that, a basic question, can you help me clarify this or that? I think it could be a great tool, but just knowing that access is there is really helpful. And I think a great way to, again, it's an extension of that in-person communication. And sometimes I'll just email, I'll do a scheduled send. I'll try these little tips. Hey, you know what? They told me that they're going to have this test or procedure maybe with another doctor that day. Or even, for my patients who I really know well, oh my gosh, they're doing this trip. Maybe I'll just send a little check-in, and it's scheduled, send it. And, it kind of works, but it just goes such a long way to know that they have another level of engagement. So that's a big aspect I've seen is the teams around our providers. We have executive care coordinators, we have general managers, we have a medical operations team. And, those that are patient facing are super engaged and just, want to do a good job. And I see it from the questions they ask me, they ask us, their, advocacy for the patient. Sometimes they go, hey, they didn't get a response yet. I just want to make sure we're on top of this. That all is for me so impressive because when I worked, in the hospital system, I loved it. And I worked with really great people, in the OR or the offices. But sometimes I would make a request, hey, oh man, I forgot, I needed that special instrument for today. And I would literally get like a, okay, you know, 'cause- and I get it. Everyone's hustling and working hard. And, there's a lot going on, but just that kind of exhausted, energy. I find now where, we're all really kind of, I call it a hospitality in healthcare attitude. It's funny that this book actually, you see, I have 4 copies, ended up in my frame because I've been really obsessed.
Is that unreasonable hospitality?
Yes, yes, yes,
I
yes.
love it. I love the book. Yes.
Yes, I cannot believe. I mean, I'm from I'm a New Yorker, so like I love obviously that aspect of it, but I didn't realize how many times I would just say, "We have to do this. We have to do it." Oh my gosh! So I changed my huddles to do that. I'm actually doing a book club on it. Just like voluntary for the company, for our providers and our medical operations team. But over and over again, it was just that make it personal, put in the time and effort. But also, what I didn't expect about the book was take care of your teams. If you take care of your teams, you're going to get them to want to give your patients or customers that amazing experience. And maybe it can't always be, like this fine dining, amazing 5-star type of experience. But, for me, it's like, oh my God, if they're doing this at, the Four Seasons and at Love and Madison Park, why aren't we doing this in healthcare? They're paying so much attention to the customer experience. That's how we should be prioritizing the actual experience around the healthcare too. So it's just been amazing. I love that you recognized it, but I bought a bunch because I want to give him as gifts.
Yeah, one of the best books I've ever read. I love. I mean, there's parts I just listened to again and again. It's just like the mentality, like you said, it almost made you like it like took off the shackles and made you like, yes, it's okay to be like this. Like
Yes.
it's okay to demand that higher standard. It's okay to be just so, and those little things matter. And to your point, I love how important it was to get the team engaged and to get them involved and take care of them and empower them to do this. And as you mentioned, it's worked for Next Health, right? Because it's energized them, right? And it's got them going and saying, how can I learn? How can I grow? How can I do this better? So that mentality is so critically important. And again, digital is important, but they're just a means to an end, right? They're just really nice tools to be able to accomplish that. And if you just like any tools, if you use the high quality tools in the right way, you're gonna have nice refined work, right? But first you got to be a really good carpenter. Like you got to know what you're doing, right? So that you're able to take those tools and use those expensive tools in those nuanced ways. They're going to add to that level of quality and service. And it sounds like that's what you're leading the charge to do at Next Health. So I really appreciate and respect that very, very much.
Thank you, thank you. It's been a lot of growing and a lot of I think we're really just trying to get it right, and we're going to keep evolving, just as patient needs evolve and what we see out there. And I think listen, I think digital tools, like I said, they should be an extension. Is it ever wrong to be 100% telemed platform, or is it wrong to ever be a digital first experience? No, but then I think you do have to work that harder. Hey, there's a lot of website manner and webikit and all of these things that are really necessary based on the same principles. The reality is there's a huge expense for brick and mortar locations and for patients even making it into you physically. Maybe that's just not the thing. So I think there's obviously a reason that telemedicine companies exist. But for me, the ones that really do it right are still putting out a lot of content around their platforms on education. Maybe even sometimes I see they're connecting patients in a community, doing a lot of webinars on, just kind of empowering patients around the knowledge that they're doing the visits around. So it's not that I don't think that model works at all. From what I've seen for us, and we have an inpatient component. We have, our IV lounge, we have Ibu and ozone therapy, we have plasmapheresis. So we have in-person services anyway. So it makes sense for us. I think if somebody watching this and they're like, hey, listen, I'm just doing telemedicine and, keeping it easy, there's no reason there's not unreasonable hospitality or radical hospitality through that. It just has to be intentional and you have to work a little harder to establish it.
If you were to give some like parting advice, right, to medical professionals who are trying to balance the use of these new technologies, the use of a good modern digital experience with still having that human touch that in some way, form, or fashion, right, needs to be there for healthcare, at least in our modern world, needs to be there for healthcare. Kind of what's the advice that you would give to help them try to establish that balance?
Be patient obsessed. Be patient obsessed and everything else will fall in place because all of the digital tools you bring in, is it improving the patient experience, the workflow, the access, the outreach, the information they need? Is it helping the provider side? Is it giving them a more streamlined way to deliver care, to lift some of the burden we know is such an issue with providers? There's lots of great ways to do it. If your digital tool and your integrations of these automated processes are still supporting that, you're doing the right thing. If it's replacing or taking away or disconnecting, then you've done the opposite. So if you're truly being patient obsessed, I think that answer becomes pretty apparent.
I love it. Thank you. Thank you so much for your time today, Shoma. We appreciate you buying out the time to talk to us. Appreciate the great insights. Love the passion. Love the work that you're doing there. And hope to be able to have you on the podcast again at some point. I think it'd be awesome to see how that journey continues.
Oh, it would be my pleasure. And hopefully, I'm just as excited to see where the journey's going. So I would love that. Thanks so much.